Good morning. I hate to be talking about this multiple times, but I'm rather concerned about the rise of Group A strep infections in the United States. I've talked about this before, but there was a rise in invasive Group A strep infections in Europe, and now there are reports in the United States that this is occurring here as well, which is unfortunately not surprising. Normally, there are millions of cases recorded of non-invasive Group A strep infections, which is a bacterial infection that may include strep throat, impetigo, and scarlet fever, but now we're starting to see invasive Group A strep infections, which is normally pretty rare. There's about 20,000 cases per year usually, and about 2,000 people unfortunately pass away due to this bacteria entering the bloodstream and causing a severe infection. Unfortunately, we've already seen reports coming out of Colorado that 2 children have already passed away due to this bacterial infection since November, and they've already recorded 11 cases in kids, which normally they see about 1 to 2 per month in that state alone. Texas has reported about 60 cases of invasive Group A strep since October, and other states, including Arizona and Washington, are reporting rises of cases of invasive Group A strep as well. This is all occurring in the setting of an antibiotic shortage that's occurring in the United States, and this antibiotic shortage may worsen because we get a lot of antibiotics from China, and they're starting to lift their zero COVID policy, so we're expecting that there's going to be supply chain issues as a lot of people in China are going to get sick with COVID. The reason why we're probably seeing a rise in Group A strep infections is because there's been a lot of viral respiratory infections surging across the country, and secondary bacterial infections can be a result of that. I'm concerned because there's a lot of evidence to suggest that COVID-19 infections may cause immune dysregulation, so kids may have a difficult time trying to fight off infections such as strep. However, there are several things you can do to help protect your family against this rise in strep A infections. That includes making sure your kids are up to date on all of their vaccines because you want to reduce the risk of viral infections leading to secondary bacterial infections. If your child is sick, make sure that they stay at home to reduce the spread of disease. Encourage good hand hygiene and clean, highly touched surfaces. Keep in touch with your doctor if your child's sick to see if they need antibiotics. And last but not least, wear a high-quality mask, KN95 or N95, when you're in public indoor spaces to help reduce the spread of viruses and bacterial infections. I hope this information was helpful, and have a good day.